Hello, my name is Dr. Ayamikun, and you're welcome to my channel, Step by Step Plan Explained. If this is your first time on my channel, you're welcome. This channel was created to help international medical graduates settle as a doctor in the NHS in the UK. If you're yet to subscribe to my channel, please subscribe, and this will ensure that you get notifications when we release new videos. So today, I'll be talking about top tips for medical registrars. I'll be talking about top tips for medical registrars. The reason why I've decided to talk about this topic is I've become a medical registrar recently, and I can tell you it's a very tough transition. I mean, it's a very, very rapid transition from being an SHO one day to being a registrar the next day. You are going to have this feeling that will you be able to cope? Will you be able to do this? You would have several feelings of telling you may doubt yourself, have imposter syndrome, and you may have nightmares of the worst case scenarios of many things you don't know. These things would come to everyone. Everyone will have these doubts about themselves. But my top tip, my number one tip is never succumb to imposter syndrome. You see, you are a medical registrar because you deserve to be there. You've worked hard for it. You've gained the knowledge, you've gained the experience. You weren't just thrown and given the title of the medical registrar. You worked hard for it. You deserve it. So that should be your confidence. Don't ever doubt yourself. Don't ever doubt whether you can do it. You can do it. It's not as bad as many people portray it to be. I mean, it's quite demanding, true. It's very, very demanding. But don't think of the worst scenario, because people have the tendency to think about the worst scenario. Oh, what if I have this case and I don't know how to manage it? Don't think about the worst case scenario. Another very useful skill for a medical registrar, which I believe you would have gained part of this skill, is how to prioritize your jobs. But the challenge is when you become a medical registrar, now you have people that you're supervising. As when I was an SHO, at a point in time, I became a very experienced SHO, and I know how to sort out my jobs. I know everything that an SHO should know, and I can deal with really complex stuff by myself. But when you become a registrar, now you need to actually supervise people. You need to supervise other people. You need to be able to delegate tasks. That is a whole different level of responsibilities. Even though you can sort out your own jobs by yourself, you must help other people sort out their own jobs now. So you get referrals from people calling you for advice, patients you've not seen by yourself. Now, you must know how to actually give advice over the phone. You must know how to delegate jobs. You must know how to prioritize jobs. Some registrars, they want to do everything by themselves. As a medical registrar, you cannot do everything by yourself. So one of these skills that I've learned is knowing the strength of people in your team. So when you resume for a shift, you try to find out, oh, what is your grade? Where are you working? Just have a good idea of the members of your team, what grade they are, where they're currently working, so that you know their strengths and possible limitations. So when you have jobs or tasks to complete at night, when you have tasks or jobs to complete during your shift, you know exactly who to call and how to deal with it, and who to assign the task to. So it is very, very, very important. One thing that I did, or one thing that I usually do when I am on call is the junior doctors or the SHOs and foundation doctors working with me. I ensure that I teach them. Otherwise, if you don't teach them, then you'll be asked to come and do many things. What do I mean by teaching them? So when I started my on-call as medical registrar, it was in the first or second week of August, and the doctors I was working with, they were all new foundation doctors. So what I did was I already created a folder for all the useful trust guidelines and the common things they will meet or the common cases they will see at during the shift. For example, one of the common requests at night is maybe patients that are agitated and need a doctor to review them. So I send the trust guideline on agitation to these doctors so that they know exactly what to do. For example, you sometimes during your shift you get asked to prescribe laxatives a lot. So I send the trust guideline on prescribing laxatives to them, on things like management of electrolyte deficiency, hypoglycemia, DKA, HHS, all these common conditions. I created a folder and sent out this folder to all the junior doctors working with me. This would make them more confident because rather than them calling you, it gives you time to deal with more urgent issues and it helps the doctors to be more confident. So rather than them calling you every time to ask for advice, they can easily go through their guideline. That way they learn better. Then if they have any question, they can call you. So it makes your life easier as a registrar. Then it makes your junior doctors better. Then I explained to them where to get all the guidelines and showed them all the tricks and tips. I taught them many of these things and it made my life easier as a registrar. I am able to focus on more unwell patients and more urgent things. Whereas the junior doctors, because they have the guidelines, they are more confident in doing these things by themselves. Important tip I would advise is brush up your skills. Yes, good. You've been practicing some of these skills using an SHO, but now you'd need them even more. You have to take decisions based on them more. And what skills am I talking about? Things like your ECG reading skills, your radiology skills, revise your ALS scenarios, just to brush up on them, just to ensure that you're up to date and just to ensure that you are very confident in these things. You don't have to become a radiologist in radiology, but just a little bit brush up on your skills will be very, very useful. Another very important thing is don't be afraid to escalate to consultants or to even other registrars at night. So there's some time at night, or especially at night, or during any of my shifts, that I come across very challenging cases. Sometimes I have to call in other registrars that we are working together just for help and more advice. Sometimes I have to call ICU to look to review a patient, and in some cases I've had to call consultant. Don't be afraid to call consultants. Sometimes some consultants, there have been occasions whereby some consultants may become grumpy because you call them at night, but that should not deter you from calling consultant at night if needed, because if anything goes wrong, they will ask you why didn't you call the consultant. So don't hesitate to call the consultant if you think you need to. Thank you very much for watching the video today. Ensure that you save this video. You may need it later, especially if you are not yet a medical registrar. If you're yet to apply for a medical registrar job, especially if you're in training and you've not seen my video on how to optimize your CV or to optimize your portfolio, check my video on optimizing your CV. Very important. You'll find very, very useful tips. Thank you very much.